This is Catherine Maynard coming at you again with another validation video. I'm going to provide my patient some privacy and perform hand hygiene. And then I'm going to introduce myself to my patient along with asking them their name and their date of birth and validating it on their wristband. And then I'm going to tell them that they're going to be getting a Foley catheter inserted, and then I'm going to ask if they have any pain or if they have any allergies to iodine or latex. And they said no to both of those, so we're going to continue with the procedure. I'm going to pull the blankets down and pull their Johnny up, and then raise the bed to a comfortable working height, along with lowering the head of their bed. Now I'm just going to spread her legs apart. And then I'm going to place a chuck on the end of the bed for my trash. I'm going to open my Foley kit by opening the flap away from me. I'm going to perform hand hygiene again. I'm going to also get rid of my trash, which is the packaging and the paper on top of the sterile field. I'm going to keep the little sticker so I can place on top of my Foley bag for name and date of insertion. I'm going to pull the drapes away from me, staying within the 1-inch border of the sterile field without touching the contents within the box. Then I'm going to apply my sterile gloves, obviously using a sterile technique. So I'm going to, since I'm left-handed, I'm going to put my right glove on first. So I'm only going to be touching the outside of the cuff, putting on the sterile glove. And then when I have my sterile glove on, I'm going to, oh, wrong hand, I'm sorry. But then when I have my sterile glove on, I'm only going to be touching the inside of the glove. I'm just going to leave that there because I didn't want to deal with it. Then I'm just going to take my drape, let it open on its own, and then I'm going to have the shiny side down on the bed and place it under my patient, trying to avoid all contact. I don't need that drape because I'm not performing a catheterization on a male patient, so I just dropped it in my trash receptacle. And so now I'm going to be preparing my Foley catheter so I can move my workstation by my patient. So I'm just opening my swab sticks and the lubrication and taking the bag off of the Foley catheter. And I'm going to also, once my Foley is unwrapped, I'm going to place the tip of the catheter inside the lubricant, so it's an easier insertion for my patient. And I'm just going to grab my syringe. And then I forgot that I had to test the balloon, so I just took the package of lubricant off and then tested the balloon. And then put it back on and called it a day. And I also attached the syringe to the port. So now I'm going to be moving my sterile field over by my patient so I don't turn my back on it. And even though I'm left-handed, I found it easier to insert the Foley catheter with my right hand, even though it doesn't matter because the job got done anyway. And I don't need the vial, so I just threw it away. And it looks like that the catheter was touching the patient's leg, but it was not, just to confirm. And I'm just going to be taking my swab sticks and placing them in between my fingers so I have easy access to them. And then I'm just going to be cleansing the outside of the labia on each side and then straight down the middle. And I'm going to be doing it twice because I have 6 swab sticks. Discarding my trash as I go. And since my left hand is touching my patient, that hand is no longer considered sterile. So I'm going to be inserting my Foley catheter until we reach urine, or about 2 to 3 inches, and then once we hit urine, I'm going to advance it 1 more inch, and then I'm going to inflate the balloon 5 cc's because it's a 5 cc balloon, and then I'm just going to pull down until I feel resistance, so I know that the balloon is in proper placement at the neck of the bladder. Great, so now that's done, I'm going to anchor the catheter to my patient's leg so there is no tugging or discomfort. And I'm going to place the Foley bag on the side of their bed below their bladder to make sure that gravity does its job and has the urine fall so it doesn't flow back into their bladder. And then I'm just going to be cleaning up my work area and providing my patient privacy again. And I'm going to adjust their bed and cover them up. And I just said if they need anything to let me know and I will be back in. And now I'm just covering my patient up. Sorry, I had a little technical difficulty. Now I'm removing my gloves for performing hand hygiene, and then I'm getting them comfortable into the bed. And I'm not going to be doing a voiceover for the other half of my video because I think I didn't need to do one. So thank you very much for listening. I hope you enjoy the removal of my Foley. I'm providing privacy for my patient. I'm going to perform hand hygiene. Hi, my name is Catherine. I'll be your nurse today. I got an order from the doctor to remove your Foley catheter today. Can you please state your name and date of birth? Okay, great. So now I'm going to lower the head of your bed. I'm going to raise the bed to a comfortable looking height. And now I'm just going to uncover you. I'm going to put clean gloves on. John, that's okay. I'm going to adjust your legs. I'm going to detach your anchor for your Foley. And then I'm going to place a chuck underneath so you don't get, there are no stains on your bed. I'm going to take my syringe. I am going to place it, and it's going to naturally go back to the 5 cc's that I put in. And then I'm going to hold the end of the Foley close to my patient and just pull it out. I'm going to take my bag, take the chuck, place it in the trash. Whoops. I'm going to cover my patient back up. Hyperextended. And after the removal of the Foley, I just want to make sure that my patient voids within the next 6 hours. I'm going to lower their bed. I'm going to raise their bed at a comfortable height.
What?
Okay. If you need anything, just press your call bell. Thank you.